this burden, especially on women, could be a lot more because of the added responsibility that women have at their house, right? At the end of the day, after working clinically and after working in the hospital or in the community, they still are expected to come home and to be mothers, to cook and provide for the family. So the amount of burden on women is insurmountable.
Dr. Firew, what do we know about how COVID-19 impacts maternal health? So what do we know about how this virus impacts pregnant women and their unborn babies?
So far, again, based on the studies, and this again is a novel virus, so based on what we know so far, like most viruses, and specific with this COVID virus, there's not been any transmission that's recorded from mother to an unborn child, as far as we know. Maybe around delivery time, if the mother is infected and the necessary precautions are not taken, there's a chance that the newborn might contract the disease. So it's important whether they're delivering through C-section or natural delivery that all the people around the delivery room or the operating room take the necessary precautions. But so far, from what we know, the transmission from mother to an unborn child, the risks are very minimal. And even after birth, the decision comes on whether they're breastfeeding or not. And if the mother is infected, and of course, we know that a lot of the immunity is obtained through breast milk for the child. So if the mother decides to breast milk, it's important that they, especially if they're symptomatic, to cover their mouth with masks and to ensure that they take universal precautions that you'll take when you're infected and to protect others.
When a woman gets pregnant, obviously her body goes through a lot of changes. How do these changes in pregnancy impact a woman contracting COVID-19?
So in general, what we know from other studies and before COVID-19, women go through different change that puts them at a higher risk of acquiring infections. And some viruses like influenza could be more debilitating to pregnant women and expecting mothers, and the consequences of that could be more deadly for pregnant mothers. So usually from other viruses, we've learned that because of the immunity level is a little bit lower when compared to the general population. So it's very important that pregnant women take the necessary precaution, but maybe take also extra precautions unless you have to leave the house, absolutely not leaving the house. And also decreasing the risk, for example, if your partners, for example, work in a hospital or essential workers, that you start isolating before they show symptoms.